Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. Of course, we all know that the decision of which tool to use or recommend ultimately lies with the professional performing the procedure. If you're a medical, birth, perinatal professional who is on the tongue tie team, even if release is not in your scope of practice, it is necessary to provide information to guide your patients and clients to an informed decision about frenotomy procedures. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. So hi, everyone, and welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, and today we are going to be talking about the release procedure, or frenotomy, frenectomy, it's called both things, for tongue tie. We're going to talk about the different types of tools and the risks and benefits and the different types of providers, and I'll let you know what I prefer. Just to start out, I'll let you know that there is some research this is based on. We do have, there's a meta-analysis that I have come across that talks all about the comparison between the risks, the comparison between using a scissor and using a laser. So a lot of what I'm going to tell you about will be on there, and I'll include the research in the links. But so much of this is based on my personal observation and clinical experience, which in itself is evidence, right? So all of us realize that there are lots of types of evidence, and we always want to be evidence-based. But sometimes the evidence is our own clinical experience. So today you're going to hear my own clinical experience and what I have found during my years doing the work with tongue tie release and tongue tie procedures. So, so let's dive into it. Okay. So just just think about, tongue and lip ties can significantly impact an infant's ability to breastfeed effectively, which can lead to a host of challenges for both the baby and the parents. Fortunately, tongue lip tie releases which are known as frenotomies or frenectomies, are procedures that can address these issues. So today we're going to explore the tools used for these procedures, the medical providers who perform the procedures, the associated risks, and the precautions to take. So a little side note, this discussion bypasses a big chunk of important aspects of treatment of oral restrictions, including how to perform a functional assessment, when to suggest frenotomy, and other therapies that can be used to prepare for, recover from, sometimes even prevent the need for a procedure. So there's lots of other resources on these topics that can be found on my website at tonguetieexperts.net or in other episodes of the podcast. Today, I am honing in on just talking about frenotomy and frenectomy. And you're getting a sneak peek inside the Tongue Tie Experts professional course that this is going to be a part of, right? There's a whole module just on frenotomy. And we go a little deeper that we're going here, but this is basically, you're getting a sneak peek into one of the modules for the course. So as I'm doing research for the update for the course, I want to share it with everyone. So that's how I chose this topic today. So also, this conversation is referring to an infant in the breastfeeding stage, right? We're not talking about older people. We are talking about infants, not 4-year-olds, not 20-year-olds, not 50-year-olds like me who had a procedure. We're considering infants today, okay? So, of course, we all know that the decision of which tool to use or recommend ultimately lies with the professional performing the procedure. If you're a medical, birth, perinatal professional who is on the tongue tie team, even if release is not in your scope of practice, it is necessary to provide information to guide your patients and clients to an informed decision about frenotomy procedures. I promise you will be asked your opinion. It's my hope that the information in this discussion will guide you to support you as you educate your own patients. So a little background info in case you're new to this topic. What are tongue and lip ties? What are we talking about releasing? So tongue tie, also known as ankyloglossia, and lip tie occur when the frenulum, also known as the frenum, the small band of tissue that connects the tongue to the floor of the mouth or the lip to the gum, is too tight, too short, too restrictive. This can cause functional deficits related to the use of the tongue. So if the tongue cannot freely move, it can lead to difficulty with breastfeeding, other feeding, bottle feeding, feeding solids, and speech challenges, and ultimately could lead to airway dysfunction. So again, in this discussion, we are concerned with infant breast or bottle feeding. So the tools that we use for tongue and lip tie release, there are primarily two types of tools used today for releasing tongue and lip ties: scissors and lasers. So first we'll talk about the scissor release. Scissor release is a traditional method using surgical scissors to cut the frenum. It's a quick procedure, often performed in a medical office. This may or may not be enough release to provide functional movement. It depends on the provider's skill and experience with functional assessment, and more on that in a little bit. While generally safe, there are several risks to know about and potential complications associated with this method. For example, scissor procedures often result in more bleeding compared to laser techniques. Usually, skillfully applied pressure stops the bleeding quickly. But for some families, even a small amount of blood in the mouth can be really upsetting. So be cautious and aware of that. Then there are the rare cases where there can be significant bleeding. And that bleeding may require additional measures to control, such as cauterization or application of medication or stitches to get the bleeding to stop. It's rare, but it's important to know that that's a possibility. Wound infection is a possible complication of the use of scissors. The open wound created can be susceptible to bacterial infection. So this requires just proper aftercare and good hygiene, essentially to minimize this risk. And the risk is really small. But I have heard of a couple of cases of infection with a scissor release. The other thing we think about whenever we're having a surgical procedure is pain and discomfort. And that can be experienced by infants during and after a scissor frenotomy due to the nature of the cut and the potential for tissue trauma. Analgesia should be considered, even for infants who can't tell us when they are in pain. I am a strong proponent of preparing for your infant to be uncomfortable and not denying that pain and relieving that pain when possible. It's kind of like one of those things that get on my nerves when people say that babies don't feel pain. Of course they feel pain. They just can't tell us, right? Okay, so another thing that can happen, overzealous release with a scissor or improper wound care can lead to scar tissue formation at the site of the incision. And this scarring can sometimes affect tongue mobility and may require further intervention. But the complication that I have seen most in my professional clinical practice is incomplete release of the tongue. Sometimes a baby will come to me and the parents will say, oh yeah, he had his tongue tie clipped in the hospital, or the pediatrician was nice enough to do it in his office, our first visit, and I'll look under the tongue and I'll still see a frenum. So sometimes the anterior portion of the frenum is released very easily, right? With a scissor, no fuss, no muss, just a little clip, and it looks better. But if the tongue isn't moving completely, if there's not a functional assessment of how that tongue is, the tongue's ability to lift and move, there may be more that needs to be released under the tongue. So the scissor frenotomy often doesn't fully release the tongue tie, especially if it's a provider who hasn't had enough experience or training in the functionality of the tongue muscles. Many infants who have had scissor release go on to have laser revision or redoing of the procedure to achieve full mobility of the tongue. Similarly, I have noted a higher reattachment rates after scissor frenotomy, usually if the procedure was performed without recommending any aftercare exercises or lactation support to facilitate at the breastfeeding, because feeding at the breast is an exercise for those tongue muscles. But that's a story for another episode. Okay, so now I will discuss my favorite tool, the tool that I prefer to recommend, the CO2 laser. Full disclosure, I've had a financial relationship in the past with the company, the most popular company in the US that makes lasers and trains doctors and dentists to use them, and nurse practitioners, yay. But there's a good reason that I decided to support this particular company. In my experience, it is the best tool for the procedure. And I'll be explaining why the CO2 laser is a popular choice among medical and dental professionals due to its precision and numerous benefits. So how does this actually work? Like, laser sounds like something, I don't know, in my generation, a laser was something that the Star Wars movies showed us, right? It was like science fiction. But the CO2, or the carbon dioxide laser, actually emits a concentrated beam of infrared light that vaporizes the water molecules within soft tissue. So soft tissue is the tissue in the mouth. So hard tissue would be like bones or nails, right? So soft tissue, it's specialized for the soft tissue of the mouth. And this particular laser is made specifically for the type of cell that's in the mouth and under the tongue and gums too, I believe. So the process of vaporizing these water molecules allows for precise cutting with minimal damage to the surrounding tissues because it's not a heat wave. It doesn't get hot. It burns without heat, which is like mind blowing. It's hard to understand or explain. I've been to the actual physicist explaining how this works, and it's very cool, but way above my pay grade. So anyway, it's very precise and it allows for cell by cell control of what they're cutting. So that's vital for this procedure to be able to get the precise controlled tissue removal with minimal collateral damage. And this precision is particularly beneficial in areas in the mouth. So remember the complications I mentioned above, the risks of things with scissor and the risk of bleeding, right? So the laser coagulates the blood vessels as it cuts. It seals them off, significantly reducing bleeding during the procedure. This hemostatic effect, as it's called, minimizes the need for sutures due to control of bleeding. Now, in older kids and adults, sutures may be something that is done to keep the wound in a certain way. But generally, infants don't have sutures, right? Usually, infants just have the release, and then we have aftercare. But with a laser, there is minimal to no bleeding, a couple of drops sometimes. And while there is always a theoretical risk of bleeding, it's very limited with laser use. Of course, if somebody has bleeding disorders or other health, histories in their family that related to bleeding, we need to consider that, right? I'm not saying nobody will ever bleed. And of course, we have to consider the skill of the provider who is using the laser, right? So you want to make sure that the provider is very well trained to use this tool because it's a complicated tool to learn and use. But once, or you know what? They say it's easy to use once you know how to use it, but you want to be trained, right? But in general, the risk of bleeding is minimal compared to scissor release. Like almost every scissor release will bleed some if it's done completely. Okay. So other complications mentioned previously, wound infection is almost completely eliminated with this type of laser release. The laser sterilizes the tissue surface as it cuts. So it kills the germs in the area. So it reduces the risk of postoperative infections. I have never, and I've been doing this for 12, maybe 13 years, I've never seen a post-op infection in a laser released kid. Now, you have to remember the patients that I see are being done with this type of laser with dentists who are extremely experienced, right? So in my own clinical practice, I have not seen infection. Okay. It's also like less swelling than, the reaction, the inflammatory reaction, scissor versus laser, you can't compare because the laser targets tissue, reduces trauma, which also contributes to a more comfortable recovery. And although I'd still recommend discussing analgesia with the provider, there should be less pain. Theoretically, there's less pain with the laser than the scissor. Other benefits of laser over scissor is that the procedure is quick, often completed in just a couple of with less than a minute or two. It's less invasive. There's less collateral tissue damage, as I said before. Healing is faster, maybe less discomfort, right? So now I am going to throw in another caveat here and say, if you are in a place where there is no CO2 laser, or if you are in a place where nobody knows how to use a laser, if you're in a place where there is someone who has been doing tongue tie releases for 20 years with a scissor, then that is the best person to go to. that is the person that you should trust with your baby if you're comfortable with it, right? So this isn't a 100% always go with laser. It's not so much the tool, it's the person with the tool, right? So we want to be really, really careful. And, I don't want anyone to say, oh, Lisa hates scissor releases. No, I don't. But in my world, what I see, scissor versus laser, I prefer laser if it's available. And I am privileged enough to have laser dentists all around me, right? So it wasn't always like that. So when I first started practicing, I wasn't aware of one of the doctors that's not too far from me. But I couldn't find anybody very close to me. And there was an ENT doing scissor releases in his office. And I had some success with that. Not 100%, but better than nothing, right? So you want to be cognizant of the person who has the tool and is comfortable with it, right? So you wouldn't want me doing a laser release on your baby if I've never gone to a class about laser, even if I have one, right? And you wouldn't want to say no to someone who says, I'm very experienced. I know how to do even posterior tie with a scissor. I've done, 400 of them. And I have these complication rates, whatever. So you want to go to the provider, right? You want to go to the provider and let him use or her use the tool that they are comfortable with. Okay. Okay. So what types of medical providers perform tongue and lip tie releases? Could be a pediatrician, right? Often they're first to diagnose tongue or lip ties, but not very often, not in my area anyway. But some pediatricians are trained to release ties, especially if it's an anterior tie. An ENT or an otolaryngologist. Why can't I say this word today? I'm just going to say ear, nose, and throat specialists, ENT. These doctors specialize in conditions of the ear, nose, and throat and can perform complex releases. Unfortunately, in my area, most ENTs consider this a surgical procedure that needs hospitalization and anesthesia, which you don't always need. So that's something to keep in mind. Dentists and pediatric dentists, of course, this is who I like for the procedure. If they specialize, especially if they specialize in laser frenotomies and have had training, there are some oral surgeons who can do this as well. And, but for babies who are breastfeeding, I always recommend a pediatric dentist if they're available. We can have nurse practitioners, midwives who do this procedure as well, family nurse practitioners. I believe there are some physician's assistants who are trained to do frenotomy. Depending on who is in your area and who is experienced, that's who I would go with. Now, I cannot make this list of which providers you should collaborate with or refer without saying a lactation consultant. If you are not a lactation consultant, you should not refer an infant for frenotomy or do an infant frenotomy on a breastfeeding baby without a lactation consultant's referral. Okay. Lactation consultants play a crucial role in identifying tongue and lip ties and making sure that the tongue and lip tie release is appropriate, is warranted, the family is ready, the baby is ready, and all the things are in place. And there are so many other episodes that talk all about that I'm not going to bore you with that today. So as a general summary, I'm going to say this. To ensure a smooth procedure and recovery, consider the following precautions. Always choose an experienced provider. Ensure that the medical provider is experienced in performing lip and tongue tie releases. Ask about their training and experience with both methods, right? So ask them, do you use scissor? Do you use laser? How long have you been using them? What are your complication rates? What are the risks? Ask them, right? And if they say, doesn't hurt, it's a quick snip, nothing to do afterwards, don't worry about it, you're going to run the other way. That's not going to be the provider that you recommend for your patients. You want to choose a doctor or dentist or nurse practitioner who understands the team approach to tongue tie, who understands that this is not just a quick snip, right? This is a whole process. Post-procedure care, right? So you want to follow all post-procedure care instructions provided by your medical provider. This may include stretches or exercises to prevent reattachment, pain management, monitoring for signs of infection. Now, this has to be your provider because your particular doctor or dentist or nurse practitioner or midwife who did this procedure knows the way they did the procedure and what aftercare works for their patients. So we recently had a thread in our Breastfeeding Tongue-Tied Babies Facebook group where a mom was saying she didn't know what to do. She wasn't sure of the exercises and people wanted to give her exercises. And I had to keep deleting and saying, you need to ask your provider, right? You do not want to do anything that your provider did not recommend. There may be a specific reason why your provider told you to do a specific thing, and nobody on the internet should be telling you otherwise. Okay. If you don't feel comfortable with what your provider told you to do, that's a different story. Then you talk to them and say, I don't feel comfortable, and ask them, right? So-and-so said I should be doing such and such, right? So that's where you want to be careful. And if you're a professional, be very careful giving broad stroke, information and broad stroke recommendations for aftercare if you don't know how the procedure was done and what's going on for that baby, right? Okay, off my soapbox. Of course, one of the precautions is making sure you're working with a lactation consultant. Of course you do. And you want to monitor healing, keep an eye on the healing process. You should have, you should educate the parents in your care about what the wound will look like and tell them if anything is out of the ordinary, they can send you a picture if you're comfortable with that. If you notice any signs of infection, excessive bleeding is an emergency that you should report. Or if the baby's feeding difficulties persist, you want to go back to the provider who took care of you and talk to the lactation consultant, but the provider who did the procedure first, right? Okay. So in conclusion, tongue and lip tie releases can significantly improve breastfeeding outcomes and overall oral function for infants. Understanding the tools used, the type of providers who perform the procedure, the associated risks, and the necessary precautions can help the parents who come to you make informed decisions. Always consult with healthcare professionals, parents, to determine the best course of action for your child's needs. Never consider anything on the podcast or on Instagram or on Facebook to be personal medical advice. This is just general information for education. So thank you so much for being here with us today on the Tongue Tie Experts podcast. Talk to you next week.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye.
Tongue-tie cases can be confusing, but what if you had a place to ask questions,
learn from experts, and connect with professionals who truly understand. That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.